Hello and welcome in clinical chemistry. This lecture is about the clinical aspects of gastric analysis. This lecture is presented by Dr. Zuhair. In this lecture, I will talking about the most important of gastric analysis test, which this type of tests which include an interpretation of result. Before to start the gastric analysis, we have to mention some of a disease related to gastric disorder. So, gastric analysis is used clinically mainly to detect hypersecretion. This is 90% for laboratory diagnose for the diagnosis of hypersecretion of gastric fluid. So this hypersecretion characteristic mainly of Zollinger-Ellison syndrome, one of the most important disorder or syndromes related to gastric disorder, which there is a hypersecretion of gastrin. This syndrome involves a gastrin secreting neoplasm, usually located in the pancreatic islets and uh, exceptionally high plasma gastrin concentration. We have to do the basal test. Here by mean the basal test without use any activator or suppressions methods so as to collect blood after that. So when I say the basal level test, that by mean the sample can be collected at any time during the day. So the basal 1 hour secretion usually exceed 10 milliequivalent, and the ratio of basal 1 hour to maximum secretion usually exceed 60%. By mean that the stomach is not really in the basal state, but rather is pathological stimulated by the high plasma gastrin level. By mean in this graph, also the gastrin stimulated the stomach HCl to produce and excrete it in high amount without doing any dynamic test or by mean add it or make a stimulation or suppression test. Gastric analysis is also used occasionally to evaluate pernicious anemia in adults. Gastric atrophy is present in this condition and the stomach fails to secrete intrinsic factor. This one of the main reason also to do the gastric analysis for measuring the the intrinsic factor which produced by the parietal cell of the gastric cell. So this intrinsic factor is very important when it's binding with B12 vitamin, so as to protect it from destroyed. When there is abnormality or disorder in gastric that lead to abnormal or reduction produce of intrinsic factor, which this can lead to deficiency in B12 by meaning loss of its binding with B12 and normal absorption. So one of the most reasons to diagnose gastric also for pernicious anemia uh, and for Zollinger-Ellison syndrome. Gastric atrophy is present in this condition also in pernicious anemia due to failure to secrete intrinsic factor, which this intrinsic factor also can be bound with B12 to prevent degradation by gastric acid. The pH of gastric fluid in this condition typically does not fall below 6, even with maximum stimulation. That by mean we make a dynamic test by adding some substance to make HCl stimulation and secretion in high amount. In this type of disorder where there is a problem with intrinsic factors, the pH cannot be below more than 6 as pH level. And this is one of the most characteristic of the pernicious anemia or gastric disorder lead to pernicious anemia. Clearly, gastric analysis may be aid to determine the type of surgical procedure required for ulcer treatment. Are really very in very rare conditions can be used the gastric acid analysis so as to decide that the main cause of the ulcer or peptic ulcer or the duodenal ulcer is due to HSAL hypersecretion for treatment. Previously, various substances were used to stimulate gastric secretion. That by mean can be take this substance and so as stimulated HCl produced in high amount by gastric cell. This substance can be used as stimulate to gastric secretion such as caffeine, alcohol, and taste meals. But these are submaximal stimuli and absolute. That by mean not really make 100% result or good result as stimuli. So it's a suboptimal or submaximum stimuli. That by mean not really cause 100% stimulation of HCl secretion. So by mean that we need more advanced or more accurate substance that can lead to gastric 100% secretion when it is injected or stimulated. This began from 1953 until the late 1970. Histamine acid phosphatase was used as a maximal stimulus to gastric secretion. So here by mean we can use histamine acid phosphatase regard than caffeine, alcohol, and taste meal, which is more specific and most reliable to make 100% gastric acid stimuli and secretion. Because of adverse effect, some of them severe histamine has now been replaced by bentacastrin. Also, the histamine can see that lead to hyper and severe stimulation of gastric fluid and HCl. So this sometimes become have adverse effect and have defect side or harmful side. So the histamine also now been replaced by bentacastrin, which is more peripheral and good to stimulate it, gastric fluid without the effect side, which is the bentacastrin, which is a synthetic pentapeptide composed of the 4 C-terminal amino acid castrin linked to substitute alanine derivatives. Normal gastric fluid is as color, and when we take a sample of for or gastric fluid for to make a laboratory test, firstly we are looking for the appearance and color of gastric fluids, which can give a clue for some of disorder. The normal of gastric fluid should be a bit translucent, pale gray, and slightly viscous, and often has affinity acrid odor. This is the normal color and appearance and odor of gastric fluid. Abnormal color and appearance can be seen and can be related to other disorders such as plaque or reddish gastric fluid for hemorrhage and other disorder or peptic ulcer. So the abnormal color can be related to other disorder. Residual volume should be not exceed 75 ml. Residual specimens occasionally contain flakes of a blood or are green, brown, or yellow from reflex of bile during intubation procedure. This here talking about the procedure for collection of gastric fluid. This procedure is also known as intubation procedure. Intubation procedure can be done by bypass a tube through mouth to down to the pharynx and go down to the stomach, and then start to sucking uh, this fluid from gastric and collect it into a proper container, and not the collection not should be exceed 75 ml. Uh, During this sucking of gastric fluid by intubation procedure, maybe some of the bile acid from the duodenal come up and come with the fluid, so as maybe sometimes the gastric fluid have a color that green to brown due to bile uh, come during the intubation procedure. The presence of food particles is abnormal and indicate obstruction. That by mean the patient should be fasting before intubation procedure, because when there is food collected during this procedure, this can be abnormal due to obstructive disease. So what are the tests of gastric function? Or tests can be by it measuring the functional of gastric fluid. Measuring of gastric acid is a basal and maximum secretory test. That by mean can measuring the gastric HCl or fluids after stimulation and before stimulation. After an overnight fast, gastric analysis is usually performed as a 1 hour basal test, followed by a 1 hour stimulated test. Uh, that by mean the first 1 hour is also known as the basal test, and the second 1 hour stimulated test, this is also known as dynamic test, and this is done by injected of some stimulus substance to stimulate gastric fluid secretion. So the stimulated test subsequently to benzodiazepine administration. Test result revealed wide overlap among health subjects and disease patients, except for anti-acidity, by meaning that in pernicious anemia and extreme hypersecretion found in Zollinger-Ellison syndrome. Gastric peptic ulcer is usually associated with normal secretory volume and acid output. Duodenal peptic ulcer is usually associated with increased secretory volume in both the basal and maximum secretory test. Considerable overlap occur nevertheless with the normal range. Measuring gastric fluid in stimulated secretion specimen, the ability of stomach to secrete against a hydrogen ion gradient is determined by measuring the pH. Castrine levels are collected at 5-minute interval for the next 30 minutes. In patients with Zollinger-Ellison syndrome, the castrine level increase at least 100 picogram per milli over the basal level. Patients with ordinary peptic ulceration, acroredia, or other conditions show a slight decrease in castrine concentration. This one is to compare with the Zollinger-Ellison by mean. Number two, we can do the plasma castrin. Measurement of plasma castrin level is available in diagnostic Zollinger-Ellison syndrome, in which fasting level typically exceed 1000 picogram per ml and can reach 400 or 400,000 picogram per ml when compared with the normal range, which is also between 50 to 150 picogram per ml. Castrin is usually not increased in simple peptic ulcer disease. Increased plasma castrin level do occur in most pernicious anemia patients. So this is the most important test for the castrin or gastric fluid to diagnose of Zollinger-Ellison, which have a highly secretion, and to diagnose of pernicious anemia, and mainly used as a diagnosis of the peptic ulcer and the duodenal ulcer. Thank you very much, and I will see you in the next lecture.